Hi, faithful caregiver. My mom got horribly misdiagnosed almost 12 years ago now in an emergency room. My goal today is to give you some tools that will help that not happen to your loved one if you ever have to take them to the emergency room. First of all, I'm going to be going over 2 different assessment charts that you can do and you can have at home so that you can keep them in a binder, and that way if you ever have to go to the ER or even the doctor's office, you've got all their information right there on hand. The second thing I'm going to do is give you a question to ask them when you go into the emergency room with your dementia loved one that will hopefully alert them to the fact that they are going to be dealing with a dementia patient. And then the third thing I'm going to do is go over a state law that got passed in North Carolina in 2021. That's a really super important law to have. One of my dear friends helped get it passed, and this is something that you want to check into to see if you have this law in your state. Okay. And then at the end, I'll share Mom's story and what happened to her when she was in the emergency room. All right, let's go over, and I have got a ton of information to give y'all today. So I will put some of this information in the show notes just so that you have it. You know I'm old-fashioned. I'm going to be looking at paper instead of a teleprompter. So first of all, when you are trying to understand your dementia loved one in pain, the best thing that you can do is to keep good records, because that's going to show you how they are from day to day or from week to week. And they do suggest that with this pain chart that you do it at least once a week with your dementia loved one. And of course, if they're in pain, you'd want to do it once or twice a day just to see how the pain's progressing. Remember this too. Keep this in mind, please. Your dementia loved one may not be able to tell you that they are in pain. In fact, my best friend, her mom actually fell and broke her hip, and it took them 3 days to figure out that she had a broken hip, and she was actually walking with a broken hip. Because of their brain failure, they can't tell you sometimes that they're in pain even. They don't even know that they're in pain because it's not connecting in their brain. So she walked around for 3 days before they found out and figured out that the reason that she might be moaning or groaning was because she had actually broken her hip when she fell. So that's why it's so important to have these charts, because it's going to raise the awareness in your own mind of what's going on with your dementia loved one. The first one I'm going to go over with you is called PAINAD, P-A-I-N-A-D, and that stands for Pain Assessment in Advanced Dementia. That was developed by 3 different people, and it has got 6 different modules in it. I'll give you the way that you can find it and download it. And what I did was when I got it, I put it in a binder, a little binder like this, and I will tell you, and this is the PAINAD one, it has got a ton of information in this book. This is so well worth getting because, again, it's almost like a little training tool. In fact, I think it's called a toolkit. It's called a toolkit to give to caregivers, and it's going to help you understand so much about your dementia loved one and give you ways to keep up with it. In the back of it, like in the appendix, there's like a medicine chart that you can keep up with, a medication list. It has got all sorts of pain behavior chart. It's got that there. It has got preparing for a healthcare visit with your provider. It has got a lot of information back here that's going to be very, very helpful to you. So I hope that you will get this PAINAD toolkit. And let me tell you some of what's in it, and then you'll understand why I really like this. And it's a toss-up between this one and the next one I'm going to show you. This one's not quite as detailed, but it's more known, I think, in this particular area at least. All right, for instance, this is the little chart that they're going to give you, and it says this. It's going to tell you about how to observe your dementia loved one, and it's going to show you what you can look for. For instance, breathing, and is it normal? Is it occasional? Is it labored? Is it short? Do they have hyperventilation with it? Or is it noisy breathing? And what you're going to do, and it will explain all of this to you, it's going to give you a 1 or a 2, and then there's a 0, and then you're going to list over here the numbers, and then that's going to be able to help you evaluate more where your dementia loved one is and what their pain level is like. Then it's going to even have like the problem with dementia loved ones a lot of times is that they can't vocalize what's wrong with them. So you just have to look at what they're doing. Are they moaning, or are they groaning? Or are they slurring their words when they're talking? Or do they keep calling out to you or yelling at you? You know, because sometimes a dementia loved one will hit you and yell just because they don't even know that they're hurt. They don't know that there's something internal going on, or that they've broken something. So they have all these physical things that you can see that will help you assess if you need to get them to a doctor, or if you need to get them to an emergency room. Another thing that you look at, and this is what I kind of grew up knowing to look at, was facial expression. If they're smiling, or if they're just staring in a trance, or if they're scowling, or if their face is clenched up. That's really all I knew to look for, was facial expression. But there's so much more that you can look for in your dementia loved one that will help you to analyze what's going on with them. Like their body language. Is it relaxed? Is it just relaxed like this? Or are they just tense and tight? Or are their fists clenched like this? All of this is trying to tell you something, because they cannot vocalize it. And can you imagine how frustrating that would be, to know that something's going on but you can't even tell somebody what it is? And then, can you console your dementia loved one? That's another one that they have you to look at and figure out if they're distracted, or if they push you away, or if they're reassured when you touch them. And all of this adds up. When you add these numbers up, it's going to give you a total score. And then in this book, it's going to tell you kind of where they are. So the pain assessment in advanced dementia, PAINAD is the short form of it, is a really good one to have, and to have on hand. The second one that I really, really like, it's more detailed. It is more detailed. This was developed by a Dr. H. I call him Dr. H because when you see his name spelled out, I'm going to spell it out right here, in fact. I'm going to spell it out on the video. There is no way I can even begin to pronounce that name. But he was up in Saskatchewan, Canada, and he and a couple of other people up there came up with this particular assessment, and it's called the PACSLAC-2. There was a PACSLAC-1, I believe, and then they updated it to a PACSLAC-2, and that stands for Pain Assessment Checklist for Seniors with Limited Ability to Communicate. And I, again, will tell you that even people in facilities, when they have things like this that they can look at and check off, it just helps them keep up with your dementia loved one and what's going on in their life. The PACSLAC-2 has more behaviors listed on it, and they do grade it a little differently than the PAINAD is. Either one of them are good to get, and I will, again, I'll put in the notes or in the description in the video ways that you can get this and you can download it. This comes in like a PDF file, very easy to download, and I hope that you will get, I will get both of them, really, because you can learn from both of them, and they're both free. You can download it all. That whole toolkit that is pages and pages is free. It's free for you to have. You just have to download it and put it in a binder, and that way you'll have it. But you want to keep up with a checklist on a regular basis, because that way you know what's going on with your dementia loved one, and it's easily accessible. I know sometimes we think we can remember, but with everything going on in the craziness of taking care of a dementia loved one, sometimes we just forget things. So having it written down makes a huge difference. Okay, so before you even end up at the emergency room, this is what I would do. I would call my local hospital that I would be taking my dementia loved one to and ask to speak to the manager or the head nurse in the emergency room. Then ask them what is the assessment paper that they use in order to evaluate your dementia patients or their dementia patients, because you might be surprised. I called several months ago to our local large hospital in the area and then our local small town hospital, and I asked them, okay, which one do you use? Do you use PAINAD or do you use the PACSLAC in order to evaluate dementia loved ones? Because they are specially made for people that are nonverbal and that have a hard time communicating. And I could not believe that our local large hospital did not even know what I was talking about. I said, so you've never heard of PAINAD or the PACSLAC-2? And she's like, I've never heard of those. and we had a very good conversation. I was just shocked because they didn't have that as part of their protocol for the emergency room. So I went through it with her and told her how she could find it, because she said, we're always looking for new ideas and everything. So I told her about that and, hung up, and it was a friendly conversation. So then I called the local medical center here in the small town that I live in and asked their emergency room which assessment tool did they use for dementia loved ones, and they didn't have one either. I'm telling you, I was just shocked. I was just surprised. So I called again, and this was the first time I called them was several months ago. I called again a couple of days ago or a day ago, and I asked them, and they actually have PAINAD now that they use in that particular emergency room. So that is why I would check on it if I was you, and if they don't have either one, after you've studied through these and you can talk to them about it a little bit, just suggest that it might be a good idea to have them, because there are a lot of dementia patients in the area and that they'll be coming there, and it will help you evaluate them. There was actually a study done in Australia where they used the PAINAD, and once they started using that evaluation PAINAD sheet in that emergency room where they did the trial, they found out that dementia patients on average got through the process 60 minutes quicker than without that PAINAD. So you can see why it's so important to have specialized evaluation tools for dementia loved ones. So if I was taking a dementia loved one to the emergency room now, the question I would ask is this: do you all use the PACS-LAC-2 or the PAINAD evaluation sheet? That's going to alert them to three things. Hopefully, it will alert them to the fact that they're going to be dealing with a dementia patient. Also, it's going to let them know that you know what you're talking about. And using the term PACS-LAC or PAINAD in front of your dementia loved one is better than saying, how do you check out people that have memory problems in front of them, because they might get ticked if you say that. You don't know how they're going to react to that. The dementia loved one might not like hearing that about themselves. So using the term PACS-LAC or PAINAD is just an easier term for them to hear. And the second thing is this: that way doctors and nurses will know that just because they ask your dementia loved one if they're in pain and they shake their head no, that doesn't mean that that's actually the real answer. And you having this folder that's got the assessment charts in it that you've done, if you just hand that to them, they can look at it and they can see where they have had pain and see how it's charted. That's going to give those doctors a huge amount of respect for you, and it's going to help them to communicate better with you, because they're going to know that you've got some really valuable information to give them about this patient. And the third thing it's going to do, because they realize that you know a lot about this patient and that you have it charted, they are going to connect with you mentally more, and they're going to listen to you more about what you're saying about your dementia loved one. Some doctors kind of just check you out, and again, I love the medical profession, and I've told them many, many times in person, thank you for going to school to learn how to take care of us, and I mean that. But some doctors do not pay as good attention as other doctors, and you have to be the one to advocate for your dementia loved one. Realize you're their advocate, you're their voice, and it's okay to advocate loudly. You can do it kindly and loudly, but all this information that you've got right there in this little binder is going to be a huge help if you ever have to go with your dementia loved one to the emergency room. Okay, let me go over that law with you that my friend helped get passed after his mom passed away from isolation. It's called the No Patient Left Behind Act, and that was passed here in the state of North Carolina in 2021. That's when the governor signed it into law. What that law does is it allows at least one person to be with a dementia loved one, either in a health care facility like a hospital or wherever it is that you take them, and it also allows them to be in a facility if they're in a facility and not in your home. And we all know how vital and important that is to their well-being, to have somebody with them that actually understands them, because if they're left alone in a room in a hospital, it's just not good. They can't push a call button if they need help. They cannot get the help that they need. So it's just essential that there be at least one person in there with them that knows them and knows them well. Okay, let me tell you very quickly about what happened to my mom in the emergency room that time 12 years ago when my brother took her there. he had gone out with her to visit some friends. Mom had gone down some stairs, and he was holding her arm and making sure she got down safely. And when she got to the bottom, she'd never had problems walking before. He let go of her arm, and what happened was Mom tripped and fell, and she hit her head on a brick wall. And so, of course, he took her to the emergency room, and I met them when they got back home. I didn't go to the emergency room. I can't remember. I don't remember where I was that I didn't go there, but I did not go with him to the emergency room because he didn't think it was serious and just took her there to be checked out. Well, when I got here to the house, I got here right before he got here, and when he came through the door with Mom, he was literally almost dragging her. And we had to practically drag Mom, half drag, half carry her up the hall to get her into the bed. And I thought, what in the world? Why did they, number one, even send her home that drugged? Well, I got her in the bed, got her situated, and, she went to sleep for the night. Well, the next morning when I got up, I went and got in the bed with her to try and move her because she had moved her position a little bit, and I was trying to move her, holding her shoulders and a little bit at her neck. And when I started to lift her up, she hollered and went, "Oh, that hurts." And you've got to know my mom to know my mom was not a yeller. She didn't do that. Well, that just horrified me. So I called the emergency room. Well, actually, first of all, I called the ambulance, and then I took her to the emergency room. Long story short, they did some x-rays on her that they had not done the night before. And the reason, also, let me back up here. First of all, the reason that she was so out of it when my brother got her home was they had given her Dilaudid. And I don't know if you've ever had that drug. I've had it. I had it after cancer surgery once, and that stuff will knock you out. And again, I don't know why they sent her home with that, but back to when I got her back to the hospital and they did x-rays on her, I found out they had not even done x-rays on my mom. She was 88 years old. She had fallen and hit her head on a brick wall, and they did not x-ray her. And she ended up having a fractured neck, a fractured back, and a broken wrist. Yes, I was upset. I could have paralyzed my mom by taking her head like I normally would have and moving her. Just that movement could have finished that fracture off, and I could have broke my mother's neck, and I could have paralyzed her. So no, I did not sue them. Let me just tell you up front, I did not sue them. I'm not that type person to go after them because, frankly, I didn't think about it even. I was concerned with getting my mother back to health. And what happened with that fall was it threw my mother off a cliff into dementia even more. That was like the turning point. And if you've ever had a dementia loved one to fall, you understand that. There's something about once that happens to them, they just turn that corner and it gets so much worse. I know I've given you a lot of information today, but my goal was, again, to give you something that would help you when you go to the emergency room or to the doctor's office with your dementia loved one, to help you get them the best care that they can get. Thank you for taking care of your dementia loved one as always. I know it's a tough job sometimes, but God bless you and stay true.